The recently published endovascular trials clearly established the efficacy of embolectomy in strokes caused by large vessel occlusions if patients could be treated within 6 hours of onset. They also set the stage for the next set of questions to be investigated. An important one of those is whether the time window for embolectomy can be extended beyond 6 hours based on imaging criteria. As you know, all of the positive embolectomy trials required proof of large vessel occlusion with MRA, CTA, or standard angiography. In addition, they each selected cases based on the size of the core of the stroke compared to the penumbra. This was done using either the aspect score of the baseline CT scan or using specialized software for MR or CT that provides a quantitative value for the size of the core and penumbra. In the trials using the aspect score, favorable outcomes were seen in cases with an aspect score of greater than 6. The first 71 patients enrolled in SWIFT Prime were included if the core measured less than 50 cc's and the mismatch ratio was greater than 1.8. Extend IA included cases with a core of less than 70 cc's and a mismatch ratio of greater than 1.2. It is interesting to note that of all the trials, Extend IA showed the largest benefit of embolectomy compared to controls. An important factor in determining the size of the penumbra is the competency of collateral circulation. Some people with good collaterals may have favorable imaging well beyond 6 hours and have the potential for a good outcome. There are 2 trials addressing the question of an extended time window. The DAWN trial has enrolled 40 of its 500 intended subjects. This is a randomized trial of embolectomy plus medical therapy versus medical therapy alone in patients with large vessel occlusion last seen well between 6 and 24 hours before randomization, with core sizes of up to 20 cc's, 30 cc's, or between 31 and 50 cc's, dependent on the NIH stroke scale score and age. Diffuse 3 is a proposed trial with a similar randomization design in patients with onset between 6 and 16 hours before randomization, a core of less than 70 cc's, and a mismatch ratio of greater than 1.8. If positive, these trials and others may help establish imaging guidelines for case selection based on physiology rather than time alone.